This is an unconventional presentation. I'm not going to tell you the scientific way to write a paper, but slightly this will be like an unscientific way, or rather unconventional way, I would say, not unscientific, but unconventional way to write a research paper. I want to give some tips so that you can start publishing in a very rapid way, and ultimately it will end up in really sending your publication and getting accepted in a reputed journal. So the first question many people have asked me, like many consultants have asked me, that why you should publish? What is the big deal? There are consultants who are have got great practice, they are earning good amount of money, and nothing is left for them to actually achieve in this world. But then why you should publish? The most important reason to publish is, after 10 years down the practice, you have so much of data and you have done so much of work that you gain some extra knowledge when you work like this after a period of years. Secondly, you try to subspecialize yourself after a few years. Like some people are great in cardiac anesthesia, some people start liking neuro anesthesia, few are experts in giving anesthesia or performing kidney transplant surgeries, few are good in blocks. So you should actually share your experience and contribute to science in a meaningful way. You don't realize that what experience you have gained. You don't realize that how expert you have become after doing the same thing over a period of years. So you should share your experience, and it is going to contribute to the science of your field. Like if you're an anesthetist, you're definitely going to contribute some small point if you publish, and the whole world will know. And of course, with this, you are going to give new insights, novel methods, novel technologies, which will help to evaluate and manage the disease process. And remember, even if you are a great presenter, you are attending conferences, you are giving great presentations, you are regularly a faculty at conference, that is a short living thing. Even if you are in the main hall, at the most 300, 400 people will attend your lecture. They will say that, oh, Dr. Suji, Dr. Balaji has presented great presentation, and then we have learned such a lot. We have learned new things from his presentation, but that is short lived. As soon as the conference is over, everyone is going to forget your presentation. Very few will remember, and very few will pass on your message or pass on your knowledge to others. But if you publish, then the publication is going to remain permanently in the journal, and it will be contributing to your research field. So that is the biggest advantage of publication, that it is permanently available. Whoever wants to read that, it is always available, and he can reread it and achieve more experience after reading your publication. It of course boosts up your level of confidence in practice. The approach to look at the patient changes entirely if you start publications and if you start publishing your work. So that is another factor, that you have to start publishing your material. And of course, when you see your name in print, it gives immense satisfaction. So private practitioners and academics doesn't go hand in hand. This is the old impression. And of course, people who are in institutes and people who are working in medical colleges, they have a lot of residents. Few medical colleges, they have their own statisticians. And of course, the residents can keep your data, they can help you maintaining your data, they can help you compiling your data, and they can get you references. They can, if the resident is smart enough, he can write a basic paper for you. So everything is, some help is always available in institutes. But in private practice, you are alone. It is, and that's why you always feel that it is very difficult to do academics and very difficult to do publications. But you are, in spite of you being alone, you should have that aptitude and passion. People will try to push you, people will try to demotivate you, people will try to create a lot of obstacles, but your self and confidence should always be there. You should be totally committed and disciplined towards your work. Good diverse thinking and innovative ideas will help you, and some extra effort from your practice will try to achieve the goal which you want. So, what are the types of publications which are available or which you can do once you are in practice? The simplest is case report. Then next comes the original research articles, review articles, but the review articles are usually invited by the editor. and letter to the editor. Now, this is important. If you are reading journals regularly and if you read a particular article, and if you feel that you are expert enough to comment on this article, you can write a letter to the editor. It is a small letter, about 2 to 3 paragraphs, with only 1 or 2 references. And mind you, this is considered as one of the standard publications in your CV. So you can start writing letter to the editors, and that will become an one more asset, or that can be counted as one of your publications. Coming to case reports have some advantage, like it is a small, it's simple to write, it's very short, it is less time consuming, and of course it will give you confidence. But there are some negative points of case report, that it should be really unique or rare, and there should be only very few publications which should be available in the literature. Only then the case report will get accepted. The documentation should be very good for the case report. Like if it is a surgical procedure, you should have very good high quality intra-op images. Then you should have photomicrograph with spatial staining done. And if it is procedure related, then, or if it is a new unique technique that you are showing to this in this case report, then you should have some pictures or some representative diagrams to explain what exactly new technique you are going to present in this case report. And many reputed journals have stopped accepting case reports. So case reports, of course, has some advantages, but there are some lot of disadvantages of case reports. And you can gain some experience, initial experience, while writing case reports. But if it is really unique, then you go for it. If it is not a unique case, then you start writing a paper. So how to write a paper? There are certain guidelines, like the first important thing is to formulate a research question. There are some frameworks which are available, like PICOT and PEO framework, where PICOT consists of, you define the population, define the intervention, have two groups for comparison, look for the outcome, and then have a time frame to present or to analyze the data. PO is population, exposure, and framework, which you can assess. Once you have the research question, then you put it in actual publication, and there are certain checklists and guidelines to how to write a paper. Like if it is a randomized control trial or prospective study, then there is a consort, that is Consolidated Standards of Reporting Trial Guideline, where there are 25 checklists, and you can check all the checklist points which are given and see whether it fits in what you're writing or what you're publishing. Observational studies, retrospective studies, it is the STROPE guideline with 22 checklists. Prisma is for systemic reviews, that we rarely do because you should be invited by the editorial and it's difficult to write a systemic review. And for case report, it is CARE guideline or checklist with 13 points. Now, this is what I initially did. These guidelines were available, and then I started reading these guidelines and started putting these guidelines in the paper. But is it really helpful to write a paper? Not at all, because you should have a practical approach when you're writing a paper. This is what now Sujit is doing. He had actually called me to give practical tips, and I am now talking theory. But of course, I put the 2-3 slides for you because you should know what these guidelines and what these guidelines are available for publication. But don't worry, Sujit, we'll go for the most important thing. And now I'll try to explain you how to start writing a paper. And what is the first step that you have to do is to maintain an Excel sheet. Maintaining an Excel sheet is from day one. If you're not maintaining an Excel sheet, start maintaining an Excel sheet from today. Okay, so what you have to do is you have to prepare Excel sheet for the common procedures that you do, and you have to put all the data in that Excel sheet. If you are doing a retrospective study, then what you do is you prepare Excel sheet and try to get all the data from the previous patient. So many times, so much of data is missed. So many times, so many things are not written in the indoor paper or not written in the anesthesia notes. So it is very difficult to retrieve data and put it in the Excel sheet. So the best thing is maintain an Excel sheet now only. How to maintain an Excel sheet is very simple. You can carry a small tab and have an Excel sheet in your tab. It is difficult to carry laptop at all places because anesthetists keep on roaming from one hospital to another hospital. So it is best to carry a tab. To put data in iPhone or in any smartphone, it is difficult, because you don't see the Excel sheet so properly on a phone. So carry a tab, which is very cheap. You will get a very good, excellent, high quality tab for not more than about 15 to 20,000. And as soon as the case is over, put all the available data in the Excel sheet. Okay. So you are already capturing the data from today. So once the amount of work which we do is huge. If you start putting the data in Excel sheet, after 6 months, you will realize that you have huge data with you, and that can be converted into a paper. So maintain an Excel sheet. How to maintain an Excel sheet? So Excel sheet is the heart of the publication. Once you have the Excel sheet, you are ready to go for the publication. How to maintain the Excel sheet? There are some points. How would you prepare the Excel sheet? See, there are if there is a particular parameter like pulse, it is very difficult. It is very easy to put the values. If it is yes or no, like if the particular disease is present or not, then you on the upper side of the Excel sheet you put diabetes mellitus. Y is yes, N is no, and just put Y, N, Y in the Excel sheet. So this will save time. You don't have to put a type again and again in the column. And this is good for the statistician. If you give this data like this to the statistician, it is very easy. Now we do stone lithotripsy. So suppose I am doing a study on PCNL, I will put whether I have to use pneumatic, whether I have put holmium laser as 2, or whether I am using a thulium fiber laser as 3. So I'll put the data accordingly. Patient 1, in particular patient 1 is I have used pneumatic. If I have used holmium, I'll put 2. If I use thulium, I'll put 3. Similarly, in anesthesia, if you're looking at muscle relaxants and noting down what muscle relaxants you have used, one is vecuronium, rocuronium, cis-atracurium, and pancuronium. So you just write 1, 2, 3, 4, 4, 4, 3, 2, whatever the patient in that particular patient you have used, just put the number. So this Excel sheet becomes easier for you to maintain. You don't have to type the whole word again and again. So it saves time. And it is very good for the statistician. If you send such Excel sheets to the statistician, he's very happy to give you the data analysis. So the first upper heading is very, very important. Try to minimize the typing part of the Excel sheet when you try to feed the data. So this is how you maintain an Excel sheet, which is easy and which is good for the further statistical analysis. Now, if you go for original research article, you have decided that you write a paper, you already have the Excel sheet with you. Now decide whether you're going to do a retrospective study or a prospective study. Retrospective study is easy to do. Prospective study is slightly, I would not say difficult, but it is time consuming. But the chances of getting a study accepted is very, very high if it is prospectively done rather than retrospectively done. But prospective, it is time consuming and you want a rapid publication, then go for a retrospective study. So what you have to do in retrospective study? Prepare a protocol synopsis. It is very simple. Protocol synopsis consists of aim of the study, like what are you looking at, exclusion criteria, inclusion criteria, and what are the outcomes that you are looking at. So once you have the protocol synopsis, you get ethics committee approval, because ethics committee approval requires a protocol synopsis to be submitted to them. Then only they will come to know what exact paper you're going to do. Ethics committee approval is almost required for all the papers or all the publishing houses. So better to get an ethics committee approval. Once you have the ethics committee approval, data collection. In retrospective, it is easy. You have already collected the data, or then you find out all the indoor papers and start putting in your Excel sheet. Once the data is collected, you send this to the statistician for statistical analysis, and once you get the statistical analysis, you can start writing the paper. Now, a statistician is very, very important. You should have a good statistician. You don't need to have a very hi-fi or a very high-end statistician, but you should give the data in a basic format. So very few things are required if you're going to do a retrospective study. Okay. For prospective study, protocol synopsis again is important. And sample size. Calculation of sample size is important. So how do you calculate the sample size? You just take 2 or 3 prominent papers and give it to the statistician. He will calculate the sample size and tell you what is the sample size of the paper. There are multiple formulas like Cochrane formula and other formulas, but that is the job of the statistician. So protocol synopsis and sample size, once you have, then you can have a randomization. Like if there are 2 groups, how are you going to randomize? You cannot have one patient in group A, the next patient in group B, the third patient in group A, and the fourth patient in group B. It is not that way. Randomization is obtained by a standard computerized randomization tool. There are many available on the internet, and you can yourself do it just by putting the group A and group B in that protocol, and it will give a computerized statement that how are you going to randomize the patient in 2 groups. Or you can tell your statistician to do randomization. Once that is done, again ethics committee approval. Once ethics committee approval is submitted, or you get the ethics committee approval for prospective study, it is better to register with Clinical Trial Registry of India. It is not mandatory, but again, your study will have lot of weightage if it is registered to the Clinical Trial Registry of India. CTRI will accept only prospective studies. There is no need to register retrospective studies at CTRI. Once that is done, then comes the data collection. Prospectively, you are collecting the data, but here the compilation of the data is only after the last follow-up. So if you write that I am going to look at kidney transplant patient or a cardiac bypass patient for next 1 month, so after the end of the last patient which is enrolled, your study will finish 1 month after that last patient. So if we have a follow-up of 6 months, after you enroll the last patient, once his follow-up is over, then the study data will be finished or will be completed. So you have to remember that and put the follow-up accordingly. There is no compulsion to have your follow-up period. You can decide your own follow-up period, but then your study will go further if you put the follow-up period longer. And then you send all this to the statistician for analysis and start writing a paper. So this is the basic of any study. Once you have this, then you can go for writing the paper. So now start writing the paper. Now you all know that these are the headings of any standard paper. First is the abstract, then you write the introduction, then it's material and methods, then results and discussion and conclusion and references. So this is the standard protocol, or this is the standard methodology which is there in all the journals. And then you start writing a paper. I have seen people writing paper from introduction because that is the first heading. And then you're trying to write the introduction, but don't do that. I will tell you a simple method to write the paper. Once you have your statistical data with you, the first thing you write is you write the methods. Why you have done? You just write the method, how you have done, how many patients were recruited. If it is a retrospective study, you just write that what was the period of this retrospective study for 1 year, 1.5 years, or from March 2024 to April 2025, whatever the period is. Then put the number of patients which you have enrolled. Then write that you have got ethics committee approval, what exact methods you have used. If there are 2 groups, write which are the 2 groups, how the drug was administered, what were the intra parameters which were recorded, what were the post-op parameters which were recorded. So it is very simple to write material method. You don't have to look at any study for that because you have done the study, you know what you have done. Okay. So just mention the inclusion and exclusion criteria and write in detail how the study was conducted. So that completes your material method. If you want to take help of another paper, you just see 2-3 papers, how they have written the material method, and write your material and methods, like what exactly you have done, and that section is done without any extra effort. Once material methods is done, then you write the statistical analysis, how exactly it was done. This is just 1 paragraph. You get it from the statistician. He will give you. Whoever is the statistician will give you one details of the statistical analysis done. And after the material method, you just put that same paragraph in that, and that part is over. So once material method and the statistical analysis part is over, you go to results. So first you have to write material method, then you have to write results. Again, writing results is easy because you already have the data, the analysis in tabular form from the statistician. You just have to tell the statistician that I want these 4 tables, I want these 5 tables, I want these 6 tables. So he will make tables accordingly because the data is already with him and you have the results with you. So you just write the results that in group A and group B, this is what is seen. So explain the tables and figures which you have got. You just have to explain whether the age was similar, whether the distribution of gender was similar, whether the intraoperatively blood pressure, pulse, saturation, intra-arterial monitoring of the blood pressure, whether the results were same or whether they were different. You just have to explain that in the results. And whichever data is more significant, that you have to mention that this particular observation of this particular finding was more significant in group B as compared to group A. So that is results. So you just highlight that results and start writing the results. So your material method and result, these 2 sections are ready because the data is already with you and you don't have to look at any other paper, or you don't have to take help of any other references. You can just refer to few papers to see how they write results and just put it results in the section of results section, and that is done. Once that is done, then the most two important aspects of the paper are introduction and discussion. Now you go to introduction. Once you have material, so lot of things of your own paper will be clear to you that this is what I have got. And in introduction, just write what is already known on that subject. Like this is known on the subject, and what is not known on the subject, that is what we are trying to do in our application or in our study. Once you mention that, then you write or you mention that why we did this study on a particular subject, what was the main aim, what was the intention of our to write this paper, or intention to evaluate a particular procedure in a particular patient. So just write that, and this is finishes introduction. Then come to discussion part. In discussion, you first state all the positive significant results that you have got. If you're comparing two groups, then write that in group A, these were the positive results as compared to group B. Once you write the positive significant results, compare these results with other studies. So you have to actually read a lot of data which is there particular to your topic, and just try to find out whether this data is matching with the data which is already published. And you just have to mention that in that particular paragraph. In the next paragraph, you compare your results with other studies. Suppose the results are contradictory, they are not matching, then also it is okay. You have to mention that our results are not matching with the existing publication. But why are they not matching? You have to give a scientific justification. Once you give scientific justification, that will get accepted without any comments or without any objections. So explain your contradictory result. Why we feel that this was seen in our patients or in our study or during our anesthesia procedure. So just explain that. Once that is done, the next paragraph is the strength and limitations. See, you don't have to mention only the limitations of your study. You have to mention the strength also of your study. You have to mention that what was the positive aspect. Like we surgeons, when we do a study or when we write our strength, the usual pattern is we write that all the procedures were performed by a single surgeon. Now that is a very strong point in publication. Why? Because if I am in an institute and if I am performing a PCNL and PCNL is performed by 4 people, then obviously the results are going to hamper, the results are going to be different. Suppose a particular anesthetist is managing a kidney transplant patient and the transplant patient is managed by 4 anesthetists, but you are putting all the data from anesthetist A, anesthetist B, anesthetist C, anesthetist D. So the protocol, the management, the procedure, the way of thinking is going to differ slightly when a particular anesthetist is going to manage a kidney transplant patient. So if only one person has done particular procedure, right there that only one author from this publication or from this group has done all the procedures. So that is the strength of your study. Right? Also the limitations. What are the limitations? Once you start writing the paper, when you read other papers, you will understand that this was deficient in our paper. We didn't look at this point. We didn't look at this particular procedure. So just write there frankly and honestly. So the editors and the reviewers, they're very smart. They're doing this work day in and out. So once you honestly present your data, they will have a positive approach towards your paper. Once that is done, the last important point is make some recommendations, make some suggestions for change in your current practice. So you have to give some message at the end of your discussion. You have to tell them that this is what we have found and this is what we feel, that this is still superior, or this drug is still superior, or this method of anesthesiology is still superior in spite of all other methods which have come latest or which have come in practice currently. So some recommendation, some suggestion has to be made in the discussion part. And you can also write that though we have done this, future research or future more study evaluation is required, because this is what we have not seen and this has to be taken up ahead with more prospective studies and maybe more number of sample size and or more prolonged duration of follow-up, which can again alter the result of your paper. So this is what is discussion. Very simple to write. If you follow these steps, if you follow these points and you make your paragraph according to these points, you will be surprised that your discussion is almost taking a good shape and you have already written the paper completely. Coming to conclusion, just concise the summary of most important point. Conclusion should not be in more than say 3 or 4 sentences. Just write your prominent findings, clinical recommendations, and future research. That is conclusion. And at the end, write the abstract. At the end, you write the abstract, because try to understand, your paper is of 3000 words and you are going to summarize these 3000 words in only 250 words. There are hardly any papers which will accept abstract word summary more than 250. So it is very difficult. If you start writing abstract first, you will be never be able to complete your paper. It is impossible that you will proceed after abstract. So write the material method first, results, then introduction, then discussion. Conclusion you can write at the end. There is no problem because it is hardly for 3-4 sentences. But at the end, write a short summary in each section of the abstract. Abstract also has multiple sections which is defined by each journal. Write them properly as the journal wants you to. You should read the instruction for authors carefully for each journal, because if you don't follow instruction to the authors, by the journal editor will get irritated, because he knows that you have written arbitrarily, you have not read the instruction to the authors to the journal, and you have not following the journal pattern. So you have to carefully read and put it all that in your writing. So abstract should be with precise words, sentences should be short, which should convey the meaning, and it is the trailer of the complete paper. See, a movie, whenever they make a movie, they don't make a trailer first, and then they don't shoot the movie. The whole movie is made first, and then the trailer is made later on by taking small clips from the movie. So abstract is like trailer of your paper. So you have to write abstract at the end. So your paper is ready. So how to write references? This I have purposely put it at the end. So references will come only in the introduction and the discussion part. References are not to be put in abstract. References are not to be put in material method and results. So how do you write references? So whenever you are writing introduction, this is the way I do. Whenever I write introduction, suppose I am writing introduction and this is what I have written, that endoscopic enucleation of prostate is the most preferred modality from reference 1 and 2. This is what I have got from these two papers. So immediately I'll put reference at the end of my paper and put that references immediately after I write this sentence. So my two references are ready. The next sentence I write in introduction, a particular thing which have references 3 to 5. Immediately in the reference part, I'll put these references. So see, automatically when you're writing introduction, you are putting your references. So automatically they are coming there. 1 or 2 references here and there. If you want to alter, you can just change the number of references and change the number of references here. At whether 3, if you want to make 3 as 4, you can just drag 3 or copy paste to 4 and get 4 down there and change the number here. So this is the way you should write references. Similarly, when you are coming for discussion, when you are comparing a paper, this is what we have compared and we have found that the results of this paper and our paper are same. Reference number 16. Type reference number 16 and put the reference immediately. So this is the way you write references. So you don't get confused which papers you are using for references. And you have to read the full paper. You cannot just read the abstract of that reference. You will never be able to use that reference paper properly. You have to read the complete paper. There are ways to get full paper. Many papers are paid, at least in urology. Many journals are paid journals. But there is a website which is known as Sky Hub, where you can get free references. It is a website where you put the DOI and you get the complete reference. So it is a pirated website that you can contact me. I'll tell you how to get the reference. You get the full article. So that is a different part. Because of lack of time, we'll not cover that. Now the paper is ready. Now what? You have written the paper. The paper is completely ready. You have written all the sections. Everything is ready. Now what to do? Before you submit, there are 2 important things you have to note. One is to check plagiarism and second is to check grammar. You know, it is very important to do this. The most important is plagiarism. You know what is plagiarism? Chori. It is practice of taking someone else's work or ideas and passing them as one's own. So this is plagiarism. You should avoid this, because only 10% of similarity is accepted by the journals. If it is more than 10%, they will reject your paper straight away, because they have softwares to detect plagiarism. They will put your paper in the software. They will have that there's 40% plagiarism in this paper. They will reject, in spite of writing a beautiful paper. So how to avoid? Write the manuscript in your own words. Read the paper, read other references, but try to put it in your own words. Don't copy paste. Don't put the same sentences in your paper. All authors should check the manuscript so that they can revise and they can edit. and the senior author should approve the manuscript. If you follow this, you will prevent plagiarism. And the next is grammar. See, grammar, I can understand many we have not got studied in good English schools, but you have to check the grammar. You cannot, the finer aspects are done by the publishing house. They will correct the grammar. But if your grammar is very poor, it will be very difficult for the editor and the reviewers to read. And that is why you have to check the grammar. It is not necessary to check the grammar because the publishing house is there to check the grammar and put the paper in a proper format. But you have to check the grammar on your own. And nowadays it has become very easy. You write the paper the way you want, you make 1,000 mistakes, but you check the grammar at the end by using this software, which is Grammarly, but this is a paid software. You have to pay 8,000 rupees for 1 year or 6 months or something like that, and it will check grammar for you. But I was using this, but AI has changed everything. So now what you do is you go for AI. Either you use ChatGPT, Google Gemini, Claude, or Perplexity and check grammar. How to check grammar? If you put the complete article in AI, they will request you to go for pro software, that is the paid software. So we Indians are very smart. What I do is put two paragraphs in ChatGPT. Put only first 2 or 3 paragraphs. So the content is less, it will check for free. It will not ask you for money. So check 2 paragraphs and it will give a corrected paragraph, grammatically corrected paragraph, complete paragraph. Gemini will correct for you and it will give to you. But you have to read it again because they don't know the meaning of that sentence. They don't know what exactly you want to convey in your paper. So you read that corrected grammar and then alter a few words here and there so that your meaning doesn't get distorted. So every 2 to 3 paragraphs, if you put in Google Gemini, it will give you the corrected grammatical version and just copy that and put it in your paper and your grammar is corrected. So artificial intelligence has made things simple and it is becoming free now. Once your grammar is corrected, then you can submit the paper for publication. So publication is like a dead leaf butterfly. You know what is a dead leaf butterfly? It looks very unattractive, but when it opens, it's beautiful. So when you publish and when you are in it, actually, you will realize that it is enjoyable and it gives a lot of edge over your colleagues, over your other faculty members. You can really upgrade your skill, upgrade your knowledge, and upgrade your practice performances and levels. Thank you.